So suppose, so you can say right atrial enlargement on ECG based on the presence of P waves. So there are sometimes a condition like atrial fibrillation where these P waves are absent. So then how do you say in that patient whether right atrial enlargement is present or not based on ECG is we'll be reading in this session called as ECG changes in right atrial enlargement in presence of atrial fibrillation. So normally, if there is right atrial enlargement, often many a times the patients are associated found to have right ventricular enlargement as well. So because the right ventricular right atrial enlargement, because the common causes of right atrial enlargement, so that is mainly pulmonary hypertension is also responsible for right ventricular enlargement. And also what happens with the right atrial enlargement will be there and it pushes the ventricles to downwards, so the changes will occur similar. So if you find in ECG of atrial fibrillation, if there is RVH changes, there is right ventricular hypertrophy changes, which is found by like presence of QR type pattern in the right precordiates without evidence of MI. So that is tall R wave. So if the R wave is taller in V1 when compared R wave in V1 is there. So normally R wave will be not that tall in V1 and V2 because these are right-sided leads. But in presence of right atrial and right ventricular enlargement, the R wave will be dominant here. So prominent R wave in the absence of any MI or low amplitude QRS complexes in lead V1. So since V1 is more on the right side, so you can see here there is tall R wave here in the lead V1. So suggestive of right ventricular hypertrophy. And also V1 is generally present on the lead is kept on the right side of the heart, right side of the chest. So on the chest, it will be keep it in the right side of the sternum, whereas the V2 is in the left side of the sternum. And because of right atrial enlargement, what happens is right ventricle is shifted downwards towards the left side. So in V1, generally the QRS amplitude is found to be very much less when compared to lead V2. So you can see here lead V2, you can see here the QRS amplitude is this high. This is R wave and this is S wave. So QRS is very much higher in lead V2 as compared to V1. And the ratio of that, the V2 by V1 QRS voltage, if it is more than 6, it has a sensitivity of 50% and specificity of 90% to diagnose it as right atrial enlargement as well as right ventricular hypertrophy.